Hi, my name is Dr Andrew Jenkinson. I work at the American Academy Cosmetic Surgery Hospital in Dubai and also in London, and I'm a consultant in obesity surgery. I really want to talk about surgical and non-surgical treatments for obesity. We've previously talked about how diets don't really work and cause a response in the body that stops you losing weight. There are other therapies out there, including the gastric balloon, which in my experience really doesn't work long term either. And there are various different surgical procedures. There's one called the gastric band, which again is really going out of fashion at the moment, and it's been replaced really by the new procedure, which is really successful, called the sleeve gastrectomy. I think in Arabic it's translated as cutting of the stomach. We provide either the sleeve gastrectomy or the other tried and tested operation, the gastric bypass, just those two operations. They're safe, and they're really, really effective to help people lose weight. For instance, an average obese patient who comes to see me, maybe 120 kilograms, if we do bariatric surgery on them, within a year their weight will be reset to about 80 kilograms. Maybe a little bit more with the sleeve, maybe a little bit less with the gastric bypass. The difference between the two operations are subtle. The risk is the same. The gastric bypass is not more risky. The sleeve is very easy to comprehend because basically we just remove 3/4 of the stomach. So the stomach will go from the size of a melon. We remove 3/4, including the appetite gland, and the stomach is like a sleeve or a tube afterwards. It's about that wide and about that long. So it's like a tube. And this is very easy for patients to grasp, and they like that understanding. There's no malabsorption. So a patient will lose weight because the capacity of the stomach is decreased, but they won't get that rebound appetite that you get with diets, because we've taken away the ghrelin secreting or appetite secreting area of the stomach. So it's quite a good operation to really make weight loss easy. The gastric bypass probably produces a little bit more weight loss than the sleeve gastrectomy, and the weight loss is more guaranteed, and it's less likely you'll put weight on. But people find it might be a little bit complicated to comprehend and to understand. Basically, they're all done by laparoscopic surgery. The stay is 2 days for the sleeve or the gastric bypass. But with the bypass, we make the stomach into a small little pouch, the size of a satsuma or small orange, and we bypass a part of the small bowel which is attached to that gastric pouch. And actually the gastric bypass works profoundly to trick the body into thinking you've eaten a lot more than you've eaten through hormonal signaling. It's not particularly a malabsorptive procedure primarily. It's primarily designed to trick the body into sending signals to your brain to say, actually I don't really feel like eating at the moment. And again, it will work really, really easily to help reset the weight set point in your body that your body is happy with, so that it's not a struggle to maintain a weight of 75 or 80 kilograms. Probably the gastric bypass is better for people who are diabetic. It will, in a majority of patients, produce a remission or significant improvement of the diabetes. So both procedures are slightly different, but they're both really successful. They're both quite safe in the right hands, and they're really, as far as I can consider, the only really, really effective treatment for obesity that we have out there at the moment. Thank you.